is Tannaz Ameli, and I was born in Iran, and I immigrated to United States in 1980 after the Iranian Revolution. And since then, 20 years I was living in Minnesota, Burnsville, which most of my family lived there. And I was working as a medical coder, and back home I studied nursing. So I was a registered nurse back there. And then I came to the United States, I changed my major and I started doing the work as a family business, and then I moved on to be in the field of healthcare. September 2019, I woke up with a kind of like a cold symptom, and then since I had the pneumonia, so they treated me with the antibiotic, and then the x-ray I had, it showed that it's still there, so they gave me another set of antibiotic, and then I was coughing and coughing for a long time. It was a dry cough, and the x-ray would show the same thing, that pneumonia is still there. So they recommended me to go and see the specialist, pulmonary. So I went to University of Minnesota, and then I had the appointment with Mayo Clinic. I went through so many tests. They thought that it's tuberculosis and stuff like that. And so till I went to Mayo, and Mayo did the bronchoscopy, and bronchoscopy showed that I have cancer. So from there, none of the tests before showed anything. And then I had the PET scan. No other organs had sign of cancer. So they gave me the chemo. So I started the chemo for 3 months of chemo with immunotherapy. And then the last immunotherapy that I had, I was feeling so bad. So I called my doctor, and they took me to emergency room. And I was dying, and because I couldn't even walk four steps from my bed to other room. So after I came a week being in hospital in an emergency room, so I went back to my doctor at Mayo, and they were saying that I had a reaction to the immunotherapy, so they have to either go with the same thing again or different type of chemo. So while I was very weak from that first set of chemotherapy and immunotherapy, so one day one of our friends sent us the caption of the interview in ABC, I think it was, one of the major networks, that Albert at Northwestern University, he had the lung cancer, and they did the lung transplant, and he was very happy about it. So we asked our doctor if that would be a possibility for me. They said that we don't think so, but you can go and consult. So we just made an appointment here at Northwest with the oncology. And I'm there, and they said that I should be the candidate, good candidate for transplant, but they have to do some tests and stuff, which takes about 2 weeks. So and then they ask us if we go by that, if everything is good, so you're going to be cancer-free, which at that point, I couldn't believe it, that I can ever be cancer-free. And I was just in a state of shock, living with a cough that it has clear mucus out of every cough that I had. And it was like horrible. I couldn't sleep, I couldn't eat well, and so I was getting weaker and weaker. But we decided that we can go with the transplant. And if there is a chance that I can be cancer-free, rather than going through chemo and getting weaker and weaker and waiting for the day. So we did that, and here I am, cancer-free. And I still, when I talk about it, I get goosebumps. The cough was the major thing that since September 2019, that started the dry cough, and then it went to show as a wet cough. And then it started to become like a liquidish, watery things coming out of my mouth, and every single time that I coughed, and I could not sleep, and I was getting weaker and weaker, and especially after chemo. But after surgery, it was hard. It was very hard and very challenging, but deep down, I knew that I will get better. So I helped the people around me to help me to get better faster. So there is a difference between the going through treatment that you know that they can't do much for you, and then you just have this window of opportunity to live, and all the thing that they can do is just helping you to be more comfortable. Basically, the feeling of it, it's encouraging, rather than before the surgery, I was just didn't know what to look for. Oh, beautiful. They're the most wonderful team that I ever saw, either during my nursing background that I have, and all the doctors that I work with or hospitals that I work with. And this is amazing. They are wonderful, very professional. Everybody, they give you this feeling that they care for you. It's not that we care for the organization, and you are the most important of the whole thing. From the beginning, actually, from the consult that I had, Dr. Barat, the way that he spoke to me, and my husband and my brother, they were with me at that day. He just gave us this feeling that how important your disease is, and how I can help you to be cancer-free. And that moment, we all had a very good feeling about it. The way that everything was set up, that's what I talked to my husband and my family. Everything worked to this to happen, moving from Minnesota at that time and staying in Chicago, committing ourselves to be here at 1 year. So as the friends who helped us in Chicago, and all the things, the weather even, it's not that cold this year. So all these things fitting together for this time of my life, I believe that there should be some power or energy or something that, put everything together, and it went very smoothly, everything. The encouragement I was getting from my healthcare providers and my family, they were supporting me. I have a cousin in California who is a pulmonologist, and as his help during when started my journey of cancer, and his help, our friends' help, and all the cares, that's something that not everybody may be as lucky as I am. The whole journey was very difficult, but I am a person of looking forward and doing my best. So that's something that I didn't think of, during all this time. I didn't think that I'm gonna die, what will happen and stuff. So I start doing everything that I needed for in case that I die. So everyone around me have the comfortable of not, just getting. It was so shocking to us because I was a healthy person from my eating. I didn't have any other diseases or anything during my whole life. So for us, it was a shocking thing that this happened to me. Everybody said we could have think that happened to any of us except you, and I was coming with this but discouraging. No, nothing discouraged me. I just was looking forward to fight it, and with the help of my husband and brother and my cousin, we beat it. And as I always, as a nurse, always think that the patient is one of your family member. What if that patient in front of you was your family? What would you do? Do that for every patient, because that's what they're looking for. Someone who cares and someone who knows. You guys know, but you have to show that you really care for that particular patient. Not all the patients are the same.
How do you feel now?
I feel great. And I feel lucky, and I feel more lucky every single time that I come to Northwestern for the follow-ups and tests and stuff. And every single time that I see a smile of my provider that say everything looks good, and so I'm very lucky and happy.
Thank you very much for your time.
Thank you guys, and good luck.